Namaskaram, I'm Dr. Tejaswi, consultant neurologist. Doesn't brain tumor sound like end of life kind of a bad news? Well, it may not really be. So let's talk more about it. So, what exactly is a tumor or a brain tumor per se? So, any overgrowth of any particular part of the body turns into a tumor. So, when it comes to brain, we have multiple types of tumor. Something which can origin from the brain itself, or something which is arising from the layers that cover the brain. So, how serious it is? So, there are two types of brain tumors. One can be malignant, one can be benign. So, malignant in terms of growing faster as well as spreading to other parts of the body. And benign, it does grow over a period of time, doesn't mean it is safe because it depends on where it is pressing and where it is growing to determine whether the benign also is safe or not. So, these are types of tumors. So, how do we identify it? Is it not better to know the earlier red flag symptoms to diagnose it better? Because we all know that the earlier the diagnosis, the better is the outcome for any tumor for that matter. So, when it comes to brain tumor, the symptoms that you should be taking care of or being aware of is sudden onset of confusion, sudden severe persisting one sided or particular side headache, sudden new appearance of visual symptoms, new behavior or personality change. We usually see this in elderly. A different person absolutely suddenly changing into a new person overnight. And seizures, sudden onset of weakness, and sudden onset of speech abnormality. So, any of these symptoms should give you an alarm that you have to wake up and see a neurologist as soon as possible. So, what can we do about it? So, once we know that these are the possible symptoms of a brain tumor and what kind of a tumor, whether it is fast growing, whether it is slow growing, whether it is arising from the brain or arising from the layers of the brain. So, to identify what it is amongst this, we can come to a conclusion that what is the rapidity of its growth, what is the consequences it's going to give, and how can we treat it, whether we can treat it fully or it will have some lasting effects. So it is very important for you to know that not all brain tumors are fatal. No, definitely not. And most of the tumors may not even cause long lasting deficit for you. So it's important to diagnose. Thanks to the amazing technology that we have today, we are able to diagnose with non invasive methods much better and much faster. So we have a lot of contrast MRIs and PET scans and diffusion scans, which will give us tractopathies, which we can give, which is give us the idea of where it is, how fast it will probably grow, and what kind of tumor it is, and how it is growing. So once we know what are the possible treatments, begin with if it is arising or if it is localized from a particular part of the brain and away from the normal part of the brain, it can easily be excised. If it is causing certain disturbances like seizures and sudden confusions, definitely it needs to be excised. But not all tumors can be excised. And within this also, we have some robotic technology like gamma knife, where we can clear the borders of exactly the tumor of origin with minimal damage of the normal tissue. And there are much more methods of treating non-invasively also, like radiotherapy, focused gamma knife surgery, focused ultrasound therapy. There are many such techniques today available which can treat a brain tumor or a shrink a brain tumor without even touching the brain. So yes, there are a lot of techniques, there are a lot of methods. Once we know what it is, once we know what stage it is, we can actually prevent a large scale damage and a lifelong disability. So understand what brain tumor is. Do not fear the diagnosis of brain tumor. Understanding it is and what it is, and also arriving to a diagnosis earlier is always going to be better. Fear the outcome of not knowing what it could be and causing a sudden fatality, because you may at least be able to plan your life according to your condition. So same goes for the brain too. But it is important for you to understand and reach the hospital or a doctor as soon as possible. So stay safe, stay awesome, and I'll catch you in the next one.